Jessie Bell. Dr. Bell is the Claire M. Hubbard Professor of Health and Environment in the Department of Environmental Agriculture and Occupational Health at the University of Nebraska Medical Center. His research explores the relationships of climate and extreme weather on natural and human processes. He served as the lead author for the U.S. Global Change Research Program report, The Impacts of Climate Change on Human Health in the United States, a scientific assessment that was released by the White House in 2016. Before coming to UNMC, Dr. Bell developed a joint position between the Centers for Disease Control and Prevention and the National Oceanic and Atmospheric Administration. In this role, he led and coordinated a variety of climate and health projects. Dr. Bell also serves as the Daugherty Water for Food Global Institute Faculty Fellow and Adjunct Faculty for the Department of Environmental Health at Emory University. His Ph.D. is from University of Oklahoma. Let's welcome Dr. Bell.
All right, well, so I don't know if you should start off with telling everybody I did my PhD at Oklahoma and Nebraska. But I'm originally from Nebraska. I was born up here in the northeast part. And I'm going to talk about extreme precipitation and the impacts that it has on human health. First, I want to talk about one end of the pendulum where we're talking about flooding. And this last year, we saw extensive flooding throughout the United States, especially here in Nebraska. May of 2018 to May of 2019 was the wettest 12-month period on record. During that time period, for like the last 120 years, that was the wettest 12 months that we've ever experienced here in the United States. Next slide. And we know what the potential impacts were, especially here in Nebraska. We saw catastrophic flooding, historical flooding across the state. And we know that it impacted our rural and agricultural communities, especially here in the state. And there was roughly maybe 4 people that were attributed to deaths attributed to this flooding, and hundreds of people being displaced because of this flooding. And what I want to illustrate here is those 4 deaths are actually not the whole story, because the health impacts from something like this, from the flooding, is much greater than just 4 deaths. And sometimes we spend too much time focusing on the mortality, the immediate mortality, and we don't think about the long-term impacts. I'm going to talk a little bit about that with my talk here today. And there's a variety of different ways that these health impacts can potentially manifest. And it's going to be difficult for us to understand what the health impacts are, even weeks, months, and even years, if we ever fully understand what the potential health impacts are. We've got the most aggressive flies in the state up here, I think. And so we saw a number of ways that infrastructure, especially healthcare infrastructure, was impacted across the state. At least 2 hospitals sustained damage with the flooding, and over a dozen long-term healthcare facilities were evacuated due to the flooding. There was also damage to roads, flooding of roads, damage to infrastructure that didn't allow people to go to some of the locations that they needed to go to either obtain medications or potentially seek medical care. And with that, that is a lack of access to care, which means the potential for an increase in potential health effects associated with this disaster as well. And then we had our well water. There was a number of reports issued about the contamination of well water and the potential threat to well water and drinking water across the state with the flooding. Next slide. And not only with the contamination of the well water, we saw when people moved back into their communities, went back into their homes, there was flooding that occurred. There was also backing up of sewage systems into the houses. I know in my hometown of Bloomfield, Nebraska, I know that was one of the things that we experienced in some of the houses up there that actually weren't even flooded. They were at the sewage system backed up into the basements. And so, as you can imagine, when you go back into those communities, when you go back into those properties, there's a number of contaminants and a number of things that you could potentially be exposed to. And I have to give a shout out here to CS Cash, the Central State Center for Agricultural Safety and Health, for some of the work that they did with the recovery efforts. Ellen Dyson especially, she did a terrific job of organizing and mobilizing a number of students and individuals to try to put together care packets that would go out into the community. So when these people were going back into their homes and going back into those structures, that they had the appropriate gear in place to actually make sure that they weren't being exposed to some of the contaminants, or reducing the exposure to some of the contaminants that potentially were in those homes, and also dealing with some of the mold issues that might arise in the future. And then there was public service announcements by UNMC. So you got embarrassing photos of you out on the internet, and then people from your hometown calling you up and saying, "Hey, I think I saw you on TV." But that was one of the things we were talking about, was not just the immediate impacts and the threats associated with the floodwaters, but also what are some of the long-term health impacts associated with these floodwaters as well. And so this is just kind of illustrating, whenever we have a climatic disaster like this, there are the immediate impacts, and then there's the indirect or the delayed impacts that are associated with some of these events. And so by the direct, that's the initial hit. That's what happens when the storm hits. That's what happens when those populations are initially disrupted in some capacity. And then we have the indirect or delayed. And those are the things that, again, could take weeks, months, or even years to manifest and to understand. So we're talking about spreading of disease, contamination of water and food, disrupting of infrastructure, and disruption of well-being as well, especially with mental health issues that could potentially arise when some of these events occur. And so this is from a report that I was a part of a couple years ago, and one of the things that we actually wanted to highlight was flooding and how we get from a flood event all the way down to a human health outcome. And so up at the top, you have the climate drivers that are behind the flood. So increase in frequency and intensity of precipitation, increase of snow melt, rain on snow. That leads to an environmental exposure, or an exposure pathway that gets you to a human health outcome. By the exposure pathway, we have flood, debris, contamination of drinking water, evacuation of population, displacement of populations, loss of essential infrastructure. And then we have the human health outcomes at the bottom: drownings, injuries, mental health consequences, gastrointestinal, and other illnesses as well. And so that's the pathway. But we have the gray boxes on the outside. And those are really important, especially when we're talking about things in the context of public health and human health, and talking about our communities in particular. So we have the social and behavioral context and the environmental and institutional context. Again, that's what your communities look like. That's what your populations look like. That's what the area around your communities look like. And that's what potentially either causes more human health outcomes, or potentially you see less human health outcomes whenever you see one of these types of disasters. And by social and behavioral context, we're talking about social determinants of health. How many people are at risk in that neighborhood or in that community? What's the occupation of the people that are there? What's their dependency on caregivers, medications? Do you have a homeless population? What is English proficiency in that area? And then by environmental and institutional context, is the community in a flood-prone area? Is it in a vulnerable area? Do you have infrastructure in a vulnerable area? Do you have flood control in place? Do you have preparedness plans in place? And also, do you have emergency response and disaster relief to potentially help with some of these issues as well? And so whenever we have an event like this, there's always opportunity to learn. And that's hopefully what we're going to be doing as we move forward, because we're going to be facing more of these issues in the future. So now this is going to be kind of weird, because we're talking about flooding, and I know we're in the middle of flooding right now, and this is definitely something that's on everybody's mind and concern. But we always have to realize that pendulum swings back the other way, and we got to be prepared for the next major disaster that we face. And the next major disaster might be drought. In 2011, Nebraska faced historic flooding. 2012, Nebraska faced an historic drought. So we always got to be prepared for that next thing. And I'm working a lot on drought and trying to understand the impacts of drought on human health, especially here in the United States. So when we have a drought event, we have a number of climatic drivers for that drought event. So we have increases in temperature, we have decreases in precipitation, decreases in snowpack, and all these things lead to the next part, which is the exposure pathway. And so this is a change in the environment. This is the things that potentially drought changes in some capacity that can lead to a human health outcome. So dust storms, wildfires, reduction of water quality, heat waves, vector habitat change, and then food insecurity issues as well. And then on the outside, we have the human health outcomes. And drought is a good illustrator of those indirect pathways to get to human health outcomes. You know, like what I was talking about with flooding, we have the initial 4 people that reported that died. And that's very unfortunate, but we know that those health impacts are much greater. And in the same context, because there are so many pathways that we're getting to those human health outcomes, in the same context with drought, there's so many pathways that we're getting to human health outcomes. But we don't always understand that because we don't necessarily think of drought as a human health threat in any way here in the United States. Next. And so in that same context as that other slide that I showed with the flooding and going from the flooding event and how do we get all the way down to the human health outcomes, this is kind of the same thing where we have the drought types over here on the left side of the screen, and then we have the human health outcomes over on the right side of the screen. And so there's that pathway where we're getting all those human health outcomes, and then what I'm saying again is the social and behavioral context and the environmental institutional context. It's so important to understand those, what your community looks like, what your populations look like, who's at risk, and how do we identify those people so next time one of these events occurs, we know how to get the information, knowledge, and supplies to the people that are most at risk of some of these events. And so why does drought actually matter here in Nebraska? One, I think anybody that's out here realizes the impacts because especially in the agricultural community, we definitely understand the impacts of drought and why it's important. But we don't necessarily think about it in the context of our health. And one of the things that we're working on is trying to understand the relationship between drought and health. Internationally, we know that drought has likely killed more people than any other extreme weather or climate-related event. But here in the United States, we don't really identify drought as a human health threat. And we're doing some work right now looking at mortality rates across the United States and trying to identify if we see increases in mortality when we see drought events. And we started our pilot project, so this is with my postdoctoral researcher, and we're focused on Nebraska first, and we're going to expand outwards. And one of the things that we found was an increase in mortality when we experience drought here in Nebraska. And that's especially true with white males between the ages of 45 to 65 years of age, and white females 45 to 55 years of age. Next slide, please. And like I said, drought is complex. There's a number of different pathways that we can get to human health outcomes, and some of those pathways are more immediate, and some of those could take longer. And that's the same thing with the drought events that we've seen here in Nebraska, or with the flooding events as well. And mental health is one of those things. We know that agricultural workers in the United States have one of the highest suicide rates of all occupations out there. And we know that there is a linkage between a drought event and suicide rates, especially in agricultural communities. Australia has done a lot of work on this. When they've seen some very historic droughts in the recent past, they saw an uptick, a large uptick in suicides in farmers and farming communities. And we've also seen the same here in the United States. Here's an anecdotal story from a farmer talking about the alarming suicide rates in agricultural workers, and he said nothing gets a farmer down more than the drought. But some of the earliest work that was actually focused on drought and suicide was here in Nebraska that I could find. Where back in the 1980s, I'm sure some of you remember the major droughts that we had back here, and they saw an increase in suicide in some of the farming communities. And this is some of the work that I was doing when I was previously at CDC. We were trying to connect drought to suicide. This is a very complex pathway, and I'm not trying to put this up here so you can try to understand all the different steps. But what we were trying to do is basically figure out how we get from a drought event to a potential mental health outcome: depression, anxiety, or suicide. And that was just showing the linkage of it. It's obviously very complex, but we need to understand this complexity so we can give this information to public health officials. This fly loves me. I must smell horrible. R grade, good to apply. But we need to be able to understand this relationship so that we can get that out to public health officials so that they can do mitigation and try to reduce some of these impacts next time we see one of these major events. Next slide. And so I've got a lot of efforts I'm trying to lead, especially looking at drought and health. Recently, NIDIS, National Integrated Drought Information System, reached out to me and asked if I could help lead some of their efforts, try to understand the impacts of drought on human health here in the United States. They realized after some of the major droughts that we saw, the 2012 drought that hit most of the United States, the major drought that happened up in North Dakota a couple of years ago, and then the drought that occurred along the West Coast in California, that they were starting to hear from public health officials and state officials talking about the health impacts. And then they realized that they wanted to be involved in that conversation, try to understand how droughts were impacting human health and how they could better communicate that to their constituents. And so they asked me to help lead a summit earlier this year where we brought together experts across the federal government, state and local agencies, and also academics and nonprofits to try to understand what are the potential health impacts associated with drought and how do we start this conversation. We held that in Atlanta, Georgia. Water for Food also participated and supplied funding for it. I'm greatly appreciative of that. And we're going to have a series of workshops across the United States following it, talking with state and local public health officials, try to understand what are the impacts of drought on human health in their locality or in their local jurisdictions, and how do we better integrate into that conversation? How do we make sure that those state and local public health officials, healthcare providers, and also emergency preparedness folks are involved in that conversation and understand what the impacts of drought on human health and what information are they missing so that we can help fill that in moving forward. So why do we need to be ready? And why do we need to be ready for the next event? Because we're seeing changes. We've already seen a change in our temperature. Over the last century, we've seen an increase in temperature, and we've also seen an increase or a change in precipitation across the United States. Over the last 50 to 100 years, we've seen an increase in precipitation, especially in this part of the United States, around Nebraska. Next slide, please. And we know moving forward that the changes in precipitation are likely to continue. And so over the next 50 to 100 years, we expect that the summers in Nebraska are going to get drier and the winters in Nebraska are going to get wetter. So we're going to see potentially more of those extremes that we saw recently. Next slide, please. And that's what we've already seen. We've already seen changes in our extremes. We've seen changes in extreme events and precipitation and all these other events that have occurred across the United States. And not only that, we've seen the impacts of these increasing, and we've seen the costs of these increasing as well. And so this is billion-dollar disasters. It was calculated by my former office at NOAA. They calculate every disaster that exceeds $1 billion of economic loss. These are actually probably pretty low estimates because we don't count in healthcare. And they've seen an increase in billion-dollar disasters over the last 40 years. And that's all across the United States. That's partially because we've seen an increase in the frequency and intensity of these extreme events, but we've also have an increase in our population. We have changes in our infrastructure, and we have aging infrastructure as well. And so there's a variety of different things that are coming together to cause this potential, or cause this relationship, but definitely a change in extreme events is one of them. Next slide, please. And so with that, extreme precipitation is related to our health. It's always important to understand what that relationship is. And after major events like this, it's good to go and do an evaluation, try to understand what were some of the relationships and learn from some of those so the next time it happens, we can potentially reduce human health impacts. But also, like for example, drought, making sure that we're ahead of the curve and we're not trying to react the next time we face one of these major drought events. Nebraska is obviously at risk for a variety of different reasons. Like I said, this is a state of flux. We're constantly being hit with different extremes. And so we always need to be prepared for that. And our extremes are changing, and they're going to continue to change in the future. And we need to be prepared for that next event, and it's always good to have health incorporated in that conversation so we can understand what are the potential health impacts so that we can reduce those impacts in the future as well. So with that, I just want to say thank you very much. I really appreciate it, and I look forward to the questions.